Now, when you're buying something, I find buying things very therapeutic. Whenever I come off of a tough discussion, you can always find me online shopping and buying for something that I absolutely do not need, but I feel so much better after I've purchased it. It's quite therapeutic. It's either that or chocolate, and I found as I grow older, shopping is much better. I can squeeze more clothes into my closet than I can squeeze myself into the clothes. And accordingly, our next Fasting Cool is going to be super cool because we all also delve into that zone of feeling a little bit low. And we don't really know how to solve for being low other than getting together with friends, watching great movies. But out of the minds of Israel, there is a cure-all for feeling low, and it's going to change the lives of many of the people we love very much. And the American Psychiatric Association, breaking news, just found this company to be one of the most promising companies for curing depression and bipolar. And I'd like to bring up Dr. Jonathan Javitt to tell us what he's doing with his company straight out of Israel. Thank you, Jonathan. Hey, before Jonathan starts, we have Wi-Fi. The Wi-Fi code is on the back of your badge. Please be tweeting and telling your friends about the things you're seeing here so that they can share virtually in the fun that we're having today.
Thank you. Thank you for having me here. I'd like to start out by telling you about my friend Mitchell. My friend Mitchell, who started in medical school with me, who was one of the most honored graduates of Yale, of Harvard, one of the top scientists in the world in the area of pain control research. Well, 4 years ago, I talked with my friend Mitchell at the end of Sukkot, and he told me that he'd become deeply depressed, literally couldn't get out of bed, that he was going to see the doctor the next day. And the doctor gave him a prescription for Zoloft, a common antidepressant, which after 2 years left him feeling every bit as after 2 weeks left him feeling every bit as depressed as he had been. Couldn't get out of bed. Went back to the doctor. The doctor tripled the dose of antidepressant. And that's what gave Mitchell the energy to go to the hardware store and buy a ladder and a rope. So 4 years ago, I sat with Mitchell's daughters at his shiva, and they looked at me and said, "How could our father have gone crazy?" And I said to them, he didn't go crazy. There was a switch that got flipped wrong in his brain. Now, at the time I said that, I didn't have the science to back it up, but somehow I knew that it was true. So that's what caused me 4 years ago to start sitting with my brother, a senior professor of psychiatry both in Israel and the United States, who spent the last 30 years of his life studying the receptors in the brain that control thoughts and mood, who previously had focused mostly on schizophrenia. That's what gave me the impetus to start talking to my brother Dan about how do we harness that to treat people, to flip that switch, to turn off that switch in the brain that causes suicide. Because it's not just Mitchell. 500 people will die between now and this time tomorrow from bipolar depression. This is a disease that kills 1 in 3 people within 6 months. It's more lethal than breast cancer. But in breast cancer, we talk about what a terrible disease it is. In this disease, we say, well, what could that person have done differently in his or her life that would have made it different? And it's no different than breast cancer. In cancer, it's a switch in the cell that causes it to replicate. And in this disease, it's a switch in the brain that causes that drive to harm oneself. And every one of us in the room knows somebody who's had this disease. It could be a friend, a brother, a parent, somebody we knew well and we didn't understand what happened. And some of those people are special to millions of us. And look what Robin Williams said. Do I get sad? Oh, yeah. Because these are the people who are the brightest light in the room. Bipolar disease is one where people are the up person in the room. They're the light bulb that everybody wants to be near. But when they fall into a well, it's not only a deep well, it's a lethal well. And today, there's no treatment for this condition. The antidepressant drugs we have are too slow to work, and they not only that, they promote people to commit suicide. There's a black box warning on every one. So we're left with electroshock treatment that looks like something out of the Middle Ages, ruins people's memory, ruins people's lives, and all we can offer somebody with acute suicidality today is a locked room in a psychiatric hospital and electrodes on their head. Well, we have a better idea. We're actually going to flip that switch. We're going to turn off that switch that causes suicide. So for a couple of minutes, let me turn you into brain scientists. All you really need to understand about the receptors on the surface of the brain is that they allow electrical energy in and out of the brain cells. They control the rate at which thoughts are generated. And in this particular condition, there's something called the NMDA receptor, where if you don't have enough NMDA activity, your thoughts may be racing, but if you have too much NMDA activity, your thoughts slow down to the point where you begin to ruminate on those few thoughts you have, and frequently those thoughts are negative, self-destructive thoughts that can lead to suicide. Well, it turns out that we have drugs that specifically target that NMDA receptor. One of them is well known. It's a drug called ketamine, and it's like flipping a switch right away, within hours, that suicidality and depression is decreased. The problem is you can't continue to give people ketamine because it causes people to be crazy. And we know that it's a drug that can readily be abused. So my brother Dan discovered another drug, actually a very old drug that was originally developed for treatment of tuberculosis, called D-cycloserine, that affects the same region of the brain, but it's more like turning a dimmer instead of flipping a switch. And it's a drug that can safely be used by mouth for weeks at a time. And he realized that if you combine that drug with another well-known drug called lorazepam that has an independent effect, these two drugs together have a completely unexpected synergistic effect that's greater than the whole and reduced side effects at the same time. Now, these are drugs that are approved by the FDA for other purposes, but they're still experimental and certainly not for sale for this purpose yet. But that's what we're here for. So we have data in human beings, in man, showing 4 different studies proving that ketamine works within hours to decrease depression and suicidality. There's nothing new about that. The problem is you can't keep repeating the dose of ketamine. That's what the American Psychiatric Association said so loudly last week. So Dan did a study at Herzog Hospital in Israel and proved that D-cycloserine has the same magnitude of effect as ketamine, but it takes several weeks to work. And now here's the magic. When you combine the two, when you start out with a single injection of ketamine and combine it with D-cycloserine by mouth, you can sustain that effect of ketamine for weeks at a time. And in people like Mitchell and people with bipolar depression, those episodes of depression tend to be self-limited. So if you can keep somebody safe for 8 to 12 weeks, they'll go back to being their crazy, happy self, and they'll wonder how they could have ever felt so bad. But if you can't manage that acute period of depression, it's lethal. So now we have a drug combination that has an immediate 75% reduction in suicidality, according to the scales that the FDA uses as the authoritative measures of suicidality and depression, an immediate 50% reduction in depression, and we've shown that it can be sustained over 8 weeks or more. And here's what others are saying. When that last study was published out of Columbia University in New York, the Journal of Clinical Psychiatry published an editorial saying this is the first treatment that has reliably shown the ability to extend the ketamine effect. And just this month, the task force of the American Psychiatric Association, which had nothing to do with us, a completely independent task force that did a 1-year study, recognized that this molecule, D-cycloserine, is one of the 2 promising approaches to treating bipolar depression that's currently on the clinical horizon. They basically said that the other approaches, except for this molecule and one other called rapastanil, show no promise. Now, we're here to save lives, but this is also an investors' conference. And we're talking about a drug that goes into a $30 billion sector. That's the current worldwide market for antidepressant drugs. So we asked LEK, which is the leading market consulting company in the world, a company that's trusted by 8 out of 10 top pharmaceutical companies, to do a market opportunity study for us. And their conclusion is that the market value of this invention, if we successfully bring it through the FDA, is $2.1 billion. That's the present value of this invention. Now, we have potentially a rapid path to market because we're not talking about new molecules that take 10 years to get through the FDA. We're talking about repurposing existing molecules that are already approved drugs for other purpose. It's called a 505(b)(2) pathway, if you like FDA terminology. So now at 2015, we're in the process of submitting our application to do our final pivotal studies with the FDA. We're in the process of manufacturing the drug that we'll use in our pivotal studies. In fact, we just signed a relationship with Wuxi Aptec in Shanghai, which is one of the world's leading drug formulators and manufacturers. In 2016, we expect to begin enrolling patients in our final pivotal study in the United States, in Europe, and in China. By 2017, we expect to have clinical data that we can take to the FDA and ask for final approval. And our objective is to be with this drug in the market by 2018. And that entire path will cost less than $50 million to execute, and yet it will lead to a $2 billion drug that has the potential to save 150,000 lives per year or more just from bipolar disease, even before you begin to talk about the even larger group of people who have major depressive disorder. Well, we've put together the best team we can find. This is my 7th healthcare startup. The others have had successful exits. My brother Dan has spent 30 years becoming the world's expert on the chemistry of this area of the brain. Even though he's a psychiatrist, he runs a laboratory with 50 to 100 people at a time, all focused on brain chemistry. Our board includes Chaim Hurwitz, who was president and director of Teva, Jim Lawrence, who just retired as chairman of investment banking, global investment banking for Rothschild, Wayne Pines, a former associate FDA commissioner, Sherry Gleed, who just finished a term as Assistant Secretary of Health of the United States, and Dr. Feigl and Peck, who actually ran the Center for Drugs and the Center for Devices at the FDA before they retired and are now on our team. And of course, we have Rashi, who invented the word Waze. We have world-class partners. Quintiles is the world's leading healthcare research organization. Kirkland & Ellis is in the process of doing our filings for our approach to the public markets, and Solbury Capital is representing us with the banks. And that's our story. This is where you come in. We need your help to bring hope, to bring life to millions of people who lose their lives needlessly from a disease that's as simple to treat as flipping the right switch in the brain. And that's where you come in. So thank you for inviting me.